Stretch using the Nada chair. The Nada chair can be used for a hamstring stretch and an Achilles and ankle stretch. The Nada chair is put around the back and each strap is placed around the ball of the foot with the legs out straight and something supportive under the feet. You also want a stiff couch or sitting on the floor so the back is up straight. That's very important. And the straps are on the side to tighten it or loosen it to get more or less stretch. Once in this position, you can sit for up to 30 minutes at a time doing the stretch. Every once in a while, if you need to, you can take a little break by bending your knees. And after your break, just straighten your legs back out. Let it stretch ankles and hamstrings at the same time. If needed, you can use your AFOs during this stretch. Simply place your AFOs like you do in the evenings, but you'll put it on the ankle, the strap will go around the bottom of the AFO, and it adds a little bit of comfort so the strap to whatever angles you need at your wrist, hand, and fingers. I highly suggest that you get your PT or OT involved in the molding of this for yourself. It costs approximately $75 and does not require a prescription, but it is specific for right or left. So if you need one for both hands, you'll have to order a set of two, and that will be approximately $150. This model has 3 straps. It goes on like this. Fingers through the top, where the thumb is cushioned on the other side. There's a wrist strap that holds you tight inside of it. Finger strap to keep your fingers flat and extended. And the forearm strap along here. It's really easy to put on and take off, only takes a little bit of training.
Standing frames provide a constant and prolonged stretch for the ankles, knees, and hips. If a regular standing time is incorporated in the daily routine, it will have positive effects on maintenance of range in these joints as well as physiological benefits in other bodily systems. Another method to provide a sustained stretch for hips and knees is for the boy to lie prone on a wedge for a set time. Sandbags are placed on either side of the hamstring group can be incorporated into daily floor activities when playing or reading. Note that the knee should be absolutely straight and slightly out against the wall and holds this position. Manual Achilles tendon stretches should be started very soon after diagnosis. The child lies on his back in a comfortable position. The operator cups his heel firmly in one hand and rests the sole of the foot on her forearm. She stabilizes above the knee with the other hand and exerts a downward pressure on it to keep it straight. She then pulls firmly on the heel while pushing the sole of the foot up until a stretch is felt in the calf. If resistance to the stretch is encountered, first bend the knee, then stretch the heel cord, and while maintaining the stretched position, straighten the knee, using this movement to perform the stretch. Stretches for the hip flexors in the early stage are best performed with the child lying prone. The operator cups the bent knee in her hand, allowing the ankle to rest on her arm. She places her other hand firmly on the boy's bottom. She then pulls the leg up and inwards towards the other leg while exerting downward pressure on the bottom. This maneuver will also stretch the iliotibial band, which sometimes tightens in the early stage, especially when a wide base stance is adopted. When there is particular attention is paid to the upper limb when the boy is no longer walking and his arms are bent most of the day. Contractures are likely to occur in the elbow flexors, forearm pronators, wrist flexors, and the long finger flexors.
To do an appropriate amount of exercise without placing themselves at risk for injury. Someone who has recently lost their ability to walk independently may use the Alter G to get exercise in an upright position and to prevent some disuse muscle atrophy. Some of the benefits to using the Alter G. Lastly, ask them if they are familiar with Duchenne to feel out if they are knowledgeable about the risk of muscle damage with overexertion.
Help the patient
If not,
process.